So this is Dr. Asthma Goel, MD Medicine, DM from top medical schools in Delhi, and also MD USA and DM USA. Making this video on asthma, and you probably all know a child in your family or in your neighborhood who has asthma, and then and who has at times attacks of asthma where he has a difficulty in breathing, and you see the child coughing and there is a difficulty breathing, and there is a wheezing sound when he breathes out. People may have mild asthma and they have very occasionally have a attack, but for some people asthma can become a major issue and it can interfere with their day-to-day life, and sometimes it becomes so severe that you really it feels it becomes life threatening, and then you should really seek immediately emergency medical help and rush to the hospital. I wish there was a permanent cure for asthma, but unfortunately there is no permanent cure for asthma. So all we can do is to control the symptoms. So, like I said, some people may have a asthma attack very infrequently, but at the same time, some people may have asthma attack only in a very special situation. For example, exercise, and exercise precipitates asthma, and we call such a special situation or triggers. Most of the people who have asthma, they know what triggers their shortness of breath or precipitate the attacks of asthma. So you start coughing, you start sneezing, you become short of breath, and you may not be able to sleep at all at night time. So what to do? I think you have to understand, most of the people who have asthma, they know that it is precipitating certain situation, and this is what we call trigger. So we have to learn to recognize our own triggers. It may be exercise, or it may be some chemical fumes. It may be just flowering seasons and there are too many pollen in the air and you are allergic to pollen. Whenever there is attack of asthma, our airways, the mucosa of the airways become we start swelling up, and there's a lot of mucus secreted, and which makes it difficult to breathe in and out. And like I said, we have a wheezing at this time. So most of the people, so what is the treatment? Most of the people already know, if they usually carry inhaler with themselves, and if any time there is a precipitation of asthma, they use the inhaler for relief. So if you have a mild attack and it resolves by itself or with the inhaler, then you might be okay. But if you feel that you are having a very serious attack, you should absolutely seek emergency care as soon as possible. You should call the emergency number both in US and India, and also you should make aware your friends and family about the triggers and about having a serious attack, so they can help you out also. Also, like I said, if you have asthma, then family should request a physician to educate somebody with asthma as much as possible. And obviously also you should follow regularly with your physician. And once again, you should try to anticipate any triggers and avoid those situations. Or if it's precipitating your asthma, either you use your inhaler, gets better, fine, doesn't, and you think it's getting worse, you immediately seek the emergency help. Thank you.